doing its thing. Hello. Hi, welcome. I'm Stefanie Primm, and I'm the director of Living Our Visions Inclusively, and we are an organization based in Wisconsin that works with adults with intellectual and developmental disabilities. And I am joined today by the photograph of Marcia Stickel, and Marcia is on the phone with us. She is a retired nurse who spent her whole career working with people with disabilities and is very knowledgeable about everything, basically. And she has been so good as to volunteer her time to help us as we navigate this pandemic. And so has a lot of useful information that she's going to be sharing today, in particular focusing on the situation right now, as of May 26th, what we know, what we don't know, and also provide some information or ideas for folks as they think about re-entering the world. So Marcia, do you want to say hi to everybody?
Hi. We have an eventful day. Today is May 26th, so we're in phase one of getting many steps towards normal. So I think this is a good time to talk about what's next.
Absolutely. So before we dive into all of that, Marcia, do you want to we can review a little bit about what we know so far, what the situation that we're in today as far as the pandemic with COVID-19 goes?
Sure. First of all, COVID-19 is still around, and it's going to be around for a long time. But probably the best we could hope for is a vaccine in 2021. And until many, many people are vaccinated, we really can't say it's going to be well under control. The reality is still that you can get it from other people. People who don't even realize that they have any symptoms. Well, they don't have any symptoms yet. They're asymptomatic, meaning without symptoms, but either have it and don't have any problems, because for some people they don't get sick, or they just haven't gotten sick yet. So it hasn't changed and it won't change. The hand washing is critical. When you have been out and about or touching things, or that it's just really important to wash your hands, wash them long enough to sing the happy birthday song or happy wellness to me song. And also try very, very hard not to touch your face. You may see people out and about wearing gloves and think, oh, that's the way. But gloves are really, they give you a false sense of security, and whatever you touch, you then have it on your glove. And if you touch many, many things, you're getting an abundance of different things on your gloves. And therefore, you may not even think that you need to wash your gloves, but the gloves could be carrying a lot more bacteria or the coronavirus than if you were diligent about washing your hands.
Okay. So wearing gloves isn't necessarily the best way to keep yourself safe.
No. When we're just talking about in general for people going out and about, I do not recommend wearing gloves at all.
Okay.
I do definitely recommend trying to limit the touching and being careful to wash your hands. If you're not able to wash your hands, to get some hand cleaner or wipes, and make sure it has the right amount of alcohol in it so that it really can do the job. And then wearing a mask and keeping 6 feet of distance. So keeping the 6 feet of distance is just an enormously important thing. If a person wears a mask, that person is being helpful to other people. But you wearing a mask is not going to prevent you from getting somebody's virus or bacteria. Okay. So the reason people wear a mask is to protect others from what they might have, their breathing, their cough in particular, or sneezes, to stop it right at their mask and not share it with others.
Okay.
So
Marcia.
it is important to wear a mask.
Mhm.
However, if somebody is absolutely unable to tolerate wearing a mask,
Mhm.
then it's crucial. It's really crucial that everybody else wears a mask to protect that person, any
Mhm.
other person, from getting what you might have.
Okay.
There's a lot of.
I'm demonstrating wearing a mask right now, Marcia. So my voice is a little
Very
bit
good.
muffled, which is something that to think about when you're wearing a mask, that your voice might sound a little bit different, and so might other people around you. Their voice sounds a little bit just muffled, but I have
Yes.
the mask covering about half of my nose, and then it also goes underneath my chin so that it covers
Yep.
anywhere that I might breathe through. And then it is fairly tight on the sides as well, so that I'm not having a lot of anything coming out the sides of the mask. It hooks behind my ears. I'm a person who wears glasses, and so I actually have the mask kind of tucked up under the bridge of my glasses to hold it in place, because I know a lot of people have had a hard time with their mask getting foggy from their glasses getting foggy from their mask, I should say. And also it's a weird and kind of uncomfortable to wear these out in public. You feel weird, it's kind of like, am I a bank robber? What am I doing out here with my face covered up? But just to remind ourselves, right, that we're wearing a mask because it keeps other people safe. And
it's a good citizen kind of thing to do. And it is, unfortunately, has become controversial and political, which is too bad. And I've seen some kind of pretty far out misinformation posted, like on Facebook, even supposedly from a nurse video, which made me very upset, but I just deleted it. But it's safe to wear a mask unless you're under 2, or if you have a significant respiratory problem. And so it's safe to wear a mask, and you don't need to wear a mask if you're outdoors where it's not crowded. So I've seen people wear masks when they're in a car by themselves, like people driving, and that's not necessary at all. And it's not necessary if you're outdoors and you're very, very able to be at a distance from other people who are walking or doing, calisthenics, whatever. But it should just kind of be standard that if you're able to tolerate a mask, when you are in a building where other people are, you wear it. And when you are outdoors where you're going to be in relatively close contact, whether it's a bike trail that's very busy or some other place outdoors, then you should also wear a mask.
That's really helpful to know.
Yeah, it's really just, it doesn't reflect whether you're a liberal or a conservative. It shouldn't reflect whether you're a Republican or a Democrat. It reflects your thoughtfulness towards other people by wearing a mask.
Right. And the other thing too, when putting your mask on and off, I've seen that the advice, correct me if I'm wrong, Marcia, is that you should handle it by the straps and not touch the middle of it.
That's a very good idea, because you don't know if there's any virus that has come through from other people onto the outside of your mask. And so just to eliminate that risk, handle it by the loops.
Okay, that's really helpful.
As far as cleaning it, I know a couple of times ago somebody said, well, how about putting it in the microwave? And I haven't seen anything. I know that hadn't been recommended, but I did see something more recently where they did not recommend putting it in the microwave because they felt it could be a fire hazard, especially if you have a little piece of the metal to fit more closely around your nose. And if if that was in a mask and then you put it in the microwave, you could see how that could start a fire.
Sure.
Because the metal would get hot. And you've got the fabric right there.
Yep.
So again, the best way to clean them is to use hot water and soap. And if you wash them in the washing machine, that's fine. If you hand wash, that's fine. Air drying is probably okay. If you need to dry one more quickly, you could use a hair dryer, or of course it can go in a regular dryer for clothing. So for people who are doing personal cares for multiple individuals, they should well have more than one mask. They should have multiple masks. So when they are with someone doing personal cares up close, they should have a mask on.
Okay.
And if they need to go somewhere else to do personal cares up close, especially if we're talking about individuals with disabilities who are not able to tolerate wearing a mask themselves, then it is super important that the caregivers switch masks before going into another home to do caregiving. And it should be understood that there's going to be hand cleaning in between as well. I think it's really important to be doubly cautious. If the caregiver is leaving a home where there's been personal care is done, the hands should be cleaned with the hand cleaner when they leave the home, before they get in their own car, and then when they get to the next place, they should use hand cleaner before they even touch the doorknob.
Okay.
We tend to ignore, and it isn't like we have to be obsessive about cleaning doorknobs all day long in our own home when we're not in contact with anybody. But if you have people coming in and out who may be out and around because of their work, and that's going to be more people now as things begin to open up, then doorknobs are a great way to share virus. And so, and that's before the person ever steps in the house. So it's a really good thing for somebody to keep their hands, kind of a pattern that anybody's coming into the house, cleans their hands before they touch the doorknob. And then I would recommend using the wipes, or we've talked before about the solution to clean the doorknobs in a home where there is a lot of traffic.
Yeah. Kind of as part of your pattern, if you're cleaning the high touch surfaces is the term we're hearing a lot, right? Where surfaces that get touched by multiple people multiple times a day, where you can't, they just need to be cleaned pretty frequently. In particular, if you do have a lot of people coming in and out of your home from other places. So another thing that we talked about, Marcia, was that as people are kind of getting back out into the world, to be aware of, both in their homes and out in the world, that bathrooms in particular are a place where there's just going to be more of that stuff that stays in the air, those respiratory droplets, or whatever, that there's a better chance of transmitting that in a bathroom because of the number of high touch surfaces, and also just the lack of air movement, right?
Yes, definitely. And it's often cool, and the virus seems to really like that kind of environment. And I just recently read another article that makes it even more of an issue. They are finding that the virus can be in feces. And I read an article that in a person's home, just to be on the safe side, they should always close the lid on the toilet before flushing, so that there aren't any little tiny droplets coming out of the toilet. And it's folks not about urine, but specifically about feces. They're even doing some studies of sewage in some communities to get some idea of the level of COVID-19 in a community, which is not pertinent to what we're talking about today, but it's just something to be aware of.
Right.
So bathrooms, bathrooms have always been a place that are hazardous in multiple ways, but now we're adding to that the possibility of the COVID-19, the coronavirus being transmitted in the bathroom.
Yeah. Yeah. No,
So
that's really helpful to know. Close those toilet lids before you flush. I think that's good life advice in general. So
it is very well. Yes, I read an article years ago about this. Just not, of course, with coronavirus, but other kinds of things that can come out of the toilet when it's flushed. So it's really a good idea, even when we get this virus under control. Just close the lid.
Keep those habits. Yeah, like hand washing.
It's a good habit to have.
Yeah. So Marcia, since the last time we've talked like this, there has been some really good news, or better news. So let's dive into some of the positive updates that we know about COVID-19 right now.
Yes, and there really are some positives. I don't know if you're keeping track, any of you, about the percentage. And Wisconsin is doing better than many states, actually, in testing. And now you can get tested for free in multiple places, drive-up clinic or drive-up testing. And you're encouraged, if you have any doubt of whether you might have COVID-19, to get tested now. So the testing capability has expanded astronomically. That's a really, really good thing.
Yeah.
There are some more rural areas of Wisconsin that are still having more of a challenge, just with having enough reagent, which is what you need to get the testing accomplished. But so that's really good. And then the percentage of people who are tested who have been found to have COVID-19, especially in Dane County, has been going down. So that's a really good news thing too. Yeah. So we want to look at the percentage, because we're going to have more people found to have it, but there's way more people being tested. So the percentage of people who are found to have it, that's the key number, and that's really good news. Right. There also is the possibility of a rapid test. That's the one that they have at the White House. Do you want to warn, though? The rapid test it has only 80% accuracy.
Oh, okay.
And the problem with that is that that means 20% of those tests show that you don't have it when you might have it, actually.
Okay.
So people can go, really, where it's recommended as being probably the best is you go into your doctor's office, you can get a rapid test. If it's positive, you got it. If it's negative, but you're having symptoms, like you're coughing or you're having some challenges with, they've increased the number of symptoms, actually, that can be associated with it. So if you're having symptoms, you've got a headache, got a low-grade fever, then they will give you the regular test. And you will have it back. And Dane County is pretty good now. Probably get it back within 24 hours. It could be delayed in some other counties.
Okay.
So that would be the backup test if you were symptomatic and the rapid test said you didn't have it.
Right.
You would then go ahead and have the RNA test, which it's really accurate. It checks for RNA, which is the genetic material of the virus.
Okay. So there's more tests. So that's really good.
So there's more tests, and there's a test for antibodies now.
Yeah, what's that?
So that's really, and that is available in Dane County. I don't know how available. I know it's not in the drive-up ones. It's not that's not for antibodies. Antibodies show that you've had COVID-19.
Okay.
So the clinics can do the antibody test.
Okay.
So if you wonder, well, I was sick in March, they wouldn't let me have a test then because they were so limited, remember? So what if I did have it? And then you can go in and have a check for antibodies.
Okay.
And that's really nice to know.
Yeah.
And you can say, okay, I did have it. However, here's a very big but. we are not sure that when you have antibodies, that means you're not going to get it again.
Sure. Okay.
It may not provide total immunity just because you've had it.
Mm-hmm.
In fact, that one ship of Navy ship that had all the sailors that got very sick with COVID-19, hundreds of them, at least 12 of them, now that's what the last I read, 12 of them got it again, even though they'd had it once. So if it's 12 out of how many hundred, that is a low percentage, but it still is out there that it's possible you could have it and then have it again.
Right. Okay.
So that's a little tricky.
Yeah.
And so they don't want people to think, well, I can do whatever. I can be working with people who have it and not wear any protection because I'm immune. No, that's not. That's not the case.
Okay.
So, but it would be really nice for people to find out if they've had it.
Sure.
That could be nice.
Yeah.
So the other good news is remdesivir is a medication by IV that can help for people who are in the hospital. So we know people who are in the high-risk group would be people 60 and older, people with existing conditions especially. And the older you get, people in their 80s are much more likely to get critically ill and die. Mm-hmm. But for people who end up in the hospital, we now have somewhat an availability of remdesivir. It's not everywhere. And it has been distributed in our state to hospitals, but it's very limited.
And so, what does remdesivir do? Does it?
Remdesivir helps prevent a person from getting critically ill. Okay. So, say a person comes in and they might be in the ICU, but they're not on a vent. They can be given remdesivir and they can start to improve and not ever need a ventilator to breathe through. So, in other words, it's a tricky thing because they have a limited amount and they have to decide, who to give it to. But it's very hopeful, and that they have found one thing that can help when people are severely ill. Because initially, all that was known to do was to provide support to the body for the symptoms. Right. And nothing worked to help except, doing whatever you could, giving them adequate fluids, doing all of those typical, I shouldn't get too nursey here, but all of the typical things to help a person in it. If they had to, they would put them on a ventilator to breathe for them. But they have learned other things to do, maybe to prevent going onto a ventilator as well. So that's another kind of a good news thing.
Yeah. I mean, it seems like we're just a lot more prepared than we were.
That's really good news. Yes, that's very true.
Yeah.
The PPE, the personal protective equipment, there's much more available in the hospitals than there was initially.
Yeah.
And people are more prepared by far than they were initially for those who come in who are sick enough to be in the hospital. It doesn't mean that we can all be totally relaxed and think, it doesn't matter if there's a big, huge group of people who get terribly sick. Right. But it is reassuring that for people now, they're able to care for people in the hospital without a challenge as far as limited supplies. And the other good news thing, as far as medication goes, is that they're just beginning to trial this in humans. So you're at the lead of the news here. Medication, as a mouthful, peg interferon lambda. But basically what it is a medication to be used soon after you've been diagnosed with COVID-19,
Okay.
kind of like Tamiflu if you have influenza. And so then, they're hoping that would really mitigate getting very sick. But they're just beginning the testing on this. It said by Memorial Day, they hope to have all the volunteers to start working on providing this.
Okay.
So this is not something that's going to be available for probably months. But it is nice if it works. It has worked in animals. It would be wonderful if it would work for humans, because that could also really be a huge benefit in preventing people from getting, sick enough to end up in the hospital.
Okay, so it's something you would take like when you were mildly sick and got diagnosed with COVID.
So you were feeling the symptoms, initial symptoms. You go into the doctor, you find out, yep, I'm positive, and then you would get this medication.
Okay.
It's a shot, so it would be kind of like with, the flu. I think that I've actually never had Tamiflu. I'm not sure if that's a
no,
shot
it's a pill form, typically.
So this is a shot.
Okay, so something you would have to get at the doctor's.
At least, this is early on stage, so I don't want to give anybody the idea that they can, go find that within the next month or two, because they may push it if it works. They will push it quickly, but it still could be months.
Okay.
And the other good news is there's a lot of possible vaccines. The last I read was 8 possible vaccines.
Wow. Okay.
So there's been a huge push in pharmaceutical companies to develop them, and because of the need. But it's going to take a lot of time, because there has to be testing to make sure that it doesn't have side effects that are detrimental, and then they have to test people who have COVID-19. Who are in danger of getting COVID-19. They have to, give them the medication, and then see if they get antibodies, because they should have antibodies. So make sure. And then see if they get exposed to COVID-19, if it provides the immunity that's needed.
Right.
So it's, it's a process. And I think we're hopeful that things are moving quickly, but even used to take 10 years to get a vaccine. They said that last year.
Yeah.
It takes 10 years to develop a vaccine and have it widely out and widely available. And now they're hoping to do it in less than a year. So, we hope it would be wonderful if that happened.
Right. Yeah, but it is definitely not a quick thing, not a quick process.
Right.
Yeah.
And then the other thing that I think we kind of referred to, but didn't go into depth. So with all of the testing, the reason that's such a big deal and such a great thing is that then if you're positive, then we can trace, it can be done to trace who you were in contact with.
Oh, yeah.
So that they know they've been exposed. And then those people, as well as the person who had the initial positive, that those people who were exposed, then they can be tested, and people all of the people who have it can stay home until they're over it.
Okay.
And that is our best short-term hope of getting it under control.
Because there's less chance then that it's just out in the community.
Exactly.
With people not
and we
knowing
can
it.
find the people who have it and find who they've been in contact with. Then we can keep it under control in that way.
Okay. That's really helpful, and good to know that there's some good news. I think it's been hard to feel hopeful or feel like there's any sort of good news coming. So I appreciate that we spent a little bit of time on that. I do want to transition. So a lot of people that we work with are getting ready or thinking about getting ready to return to some of their activities. right, that they did before the safer at home orders started in March. And I think what's really difficult is there's a lot of information out there about what's safe or not safe. It feels like, one day you'll hear that, this type of mask is the right type of mask, and then it flips over the next day and you get different information. And so it can be just really confusing and difficult to figure out how to know or how to assess how risky certain activities are. In particular, a lot of people are thinking about, I need to get back to work. I can't keep staying home all the time. I need, my income, or, I'm just, my mental health is really suffering because I'm home all the time and I haven't been able to see my friends or do any of my normal activities. So I think one thing I think would be helpful for us to talk about today, Marcia, is just what are the different factors that people should take into account when they are thinking about returning to any of their previous activities, whether that be going back to work, seeing friends, going to any day program, or just leaving the house at all. So what are some of the things that you would think are important for people to consider as they're making those decisions?
Yeah. So first of all, the person, let's just use Joe as an example. How old is Joe? So if you're older than 50, you continue to be more at risk the older you get.
Okay.
People under 50 are much less likely to get seriously ill.
Okay.
But the next thing, does Joe have any coexisting conditions that would increase risk? So if Joe is younger but has diabetes, has high blood pressure, has a heart problem, has difficulty with breathing because of some other issues, any of those are possible risks for how sick you would get.
Sure.
So both age and coexisting conditions are factors in, if you got it, how sick you would get.
Okay. So it's not
then the other thing is,
it's not that you wouldn't get sick, it's just how sick you would get.
That's right. Helpful. So a person, say Susie is 23, and she doesn't have any coexisting conditions. She doesn't usually get things very easily, like colds or stomach flu or whatever. She probably would have. I mean, she might get it, but she probably would have almost no symptoms, or wouldn't get sick enough that she would end up in the hospital.
Right.
But Joe, if he's 59 and has some coexisting conditions, it's a higher risk just about how sick he could get.
Okay.
And then there's one other aspect of that about the individual. If Joe is a person who cannot tolerate wearing a mask, and furthermore is a person who likes to feel and touch things and put his fingers in his mouth, that is another factor that would really increase the likelihood of him getting sick. Okay. So then for Joe, you've got a high likelihood of getting sick because of his needing to touch and put his hands in his mouth. And then you've got the risks if he did get sick.
Right. Right. So that person you may advise that they stay home or keep staying home longer. Yeah. Okay.
Yeah. There's other things too, like as far as behavior, if the person likes to go right up to another person to talk, that's kind of how their behavior is. And then if you're thinking about going out in the community, then or being with other people, then you look beyond yourself and what your issues are to the world around you. Okay. So if you're going to go to work, bear with me with a little bit of math if you kind of think of it in that way. Your risk is going to be greater if you're in an enclosed space where there's not a lot of free air movement. Okay. Your risk is going to be greater if you're in close proximity to other people, or you have a job coach or somebody who needs to be right with you.
Sure.
But especially if you're traveling around through a big building and you're going up to people and handing them their mail, or doing their shredding or whatever, that increases the risk a lot because of the multiples of people.
Okay.
And then, so you have risk also by how long you're in that environment. So if you work 1 hour a day, you're going to be much less risk than if you work 8 hours a day.
Mm-hmm.
So you add in the amount of time you're in that environment.
Okay.
So there are, there's a number of things that you just have to think through. The workplace itself, if they're thoughtful about limiting risk, and some places are doing a scan for your temperature every day. Mm-hmm. That's not perfect because we know people's temperatures can vary, and some people aren't going to have symptoms with a fever even if they have COVID-19. Mm-hmm. But it would catch probably about 70% of the people who would have COVID-19, because that's about the percentage you're going to have that are going to have an elevated temperature.
Okay.
But also it kind of sets the atmosphere that this business, this company, is serious about wanting to make sure people don't come to work when they're sick. Mm-hmm. And that can be really important. It's hard for people to stay home when they feel like they're expected to be there no matter what.
Right.
And the other thing is, if they have a policy of everybody wearing a mask.
Okay.
It's a little tricky then. What about the person with a disability who can't tolerate wearing a mask and he or she still go to work?
Right.
You'd probably have to have a doctor's approval or whatever, or notes saying why you could go without a mask. Mm-hmm. But on the other hand, if everybody else is wearing a mask, they are protecting you from their coughs, their droplets, their sneeze.
Right.
And so that makes that building a lot safer to work in.
Okay.
So, so there's just, there's a lot of factors.
Yeah.
There's one more factor we haven't talked about yet. Mm-hmm. How do you get to and from work?
Right.
And there again, it's a numbers game. Mm-hmm. Are you going with someone, a driver that is living with you, so you know that the two of you, neither one of you have had the virus, you can feel pretty comfortable? Mm-hmm. Or are you having a public transportation with a driver you don't know? Mm-hmm. Is that driver wearing a mask? Right. And then, are you riding with other people? So now you think of, you're in an enclosed space, right? Mm-hmm. And you're with other people, and are they all wearing masks? The more people, the more risk. Yeah. And then how long is the ride? Is it 10 minutes or is it an hour and a half?
Oh, sure.
Remember, the longer the time you're exposed, the more likely, the bigger the load of virus that you could get.
Okay.
So, and then if the ride, are they clearing, are they sanitizing everything in between giving ride X and ride Y? That would be another issue. So it's tricky. Mm-hmm. I think you can find answers, but you almost need to make a check sheet of all of those things that you need to get answers for.
Right.
To determine how safe it is.
Right.
I would encourage, as an initial step, that I think could be okay, and I have been very diligent in social isolation, but we have had one outdoor backyard around one of those little fires. Mm-hmm. Social event, if you want to call it that. Mm-hmm. In other words, my husband and I were there. There were two other couples there. Mm-hmm. Each couple was separated by at least 6 feet, probably 10 feet.
Okay.
And, you're the person you live with, you don't have to be separated by 6 feet, but just other people.
Yeah.
So, so we all sat around the fire and chatted, and it was, wow, what a big deal, you know. But I think if people are careful in that way, that could be a start of reintegrating outside of your house.
Okay.
And, you know, the social distancing is fine. We didn't wear masks because we were very careful of keeping the 6-foot distance.
Well, and with the weather improving, you know, it's been nice to be outside, a little hot even maybe, but yeah. And Marcia, I think this was really helpful when we were talking the other day, you know, as kind of shorthand for a lot of the different risk factors, but to think about like the individual that you're trying to keep safe. Are they somebody who normally gets colds or the flu? Do they seem to have a strong immune system when they do get sick, or, you know, do they never get sick? So maybe their immune system has, you know, does a really good job of protecting them. It can kind of inform you about how good are they at those other habits in previous experience, the hand washing, the not touching your face, all of that. People who get sick a lot, probably you could guess might not be so good at some of those things, or they just have a weaker immune system overall. And so while this is a new disease, it is transmitted in the same way as other diseases. And so you can kind of look at that information, right? Am I explaining that correctly?
Yeah, no, that's a very good way of trying to decide, is going by past experience for that person. And it's a different virus, but the transmission and the getting sick would be similar. There's one other thing I didn't mention is, so like if you're going to have company or be with people like out in the backyard, think about the exposure that person has. So for instance, the people that I was with, none of them were hospital nurses, for instance.
Right.
You know, I mean, I think initially you want to be a little bit careful around people who are probably just in the thick of things. And then eventually, hopefully, that won't be so much of an issue.
Right. So also, you know, when you're having those initial contacts, not only do you think about the environment that you're going to be in and how safe that environment is, but also thinking about like, what do I know about this person and what they've been exposed to or potentially exposed to? Have they been following, you know, have they been staying pretty isolated, or have they been out in public a lot, whether by choice or due to their work or whatever else? That's really helpful to think about, I think. So for a lot of people thinking about those factors, Marcia, they might decide that it is too risky right now to start to re-enter normal activities, or, you know, what we're going to call normal activities, the things we did before the safer at home orders. So what are some things, as people are kind of projecting out into the future, you know, it's not maybe quite safe now, or the risk is too great now. What are some things that people should pay attention to that will help them know if or when it is safe to start to go back to some of those normal activities?
So in our county, we have the phases, which phase 1 started today. So you can kind of, you know, pay attention to the phases. They're going to be 2 weeks apart because they want to make sure that phase 1 doesn't cause a huge increase. And it takes 2 weeks to find that out. So definitely that's something to pay attention to as far as the news goes. The percentage, I'll go back to that again. The percentage of positive cases, that's a really big deal, because if it's a low percentage of people who are being tested, then you know there's not very much of it about and around.
Okay.
And that is one of the things that when they're doing the numbers, the data for the phases, that they're paying attention to.
Right.
And
that's new tests and new cases, right? Because if you look at Dean County overall,
it's new.
Really
it's new.
Shape.
Yeah,
right.
It's a total of new cases.
Yeah.
The other thing you could check with wherever you typically worked, and I think they could give you the information about any positive virus, because they're not giving you the names of people who would have COVID-19.
Right.
So, I think that is something that you have a right to know before you went back. And I think of the centers or work environments where you would be in close proximity to other people. So that would be another thing. Have they found ways? Plexiglass is being used, and I know, like, for salons and different places, but I don't know for work environments. Have they found ways to provide protection? Or to have people do split shifts, so there's fewer people in the building at the same time. Those would be things to find out over time. If they've developed those, then that increases safety as well.
Okay. So looking to see what those protective measures are that are being taken by the environment. Okay. The other thing we didn't really talk about, Marcia, in terms of, looking at the risk factors, is not only, the individual themselves, their age, how healthy they are normally, their coexisting conditions, all of that, but also thinking about the other members of the household, right? Because that's the other component that people are taking into account, is not just that individual might get sick, but maybe they're relatively healthy. But if they're living with somebody who has more risk factors, that's also important to consider.
Oh, yes, that's very important. I'm glad you brought that up, because you really want to base decision making on the most vulnerable person in the household.
Okay. That's a good way of saying it.
Yeah, because you would feel terrible if you brought it back and you didn't get sick, but the other person ended up severely ill in the hospital. And it's very hard to prevent sharing in the same household. Now, we do know, we've gone over that in the past, if somebody does present positive in a household, all of the things that have to be done, disinfecting and so on, and isolating the person and not sharing a bathroom and all of that. And then, for sure, a person working with them, that's when gloves are appropriate, working with that person, and then taking them off when you come out of that room in which the person is isolated. But it would be much, much better to avoid that situation completely. And much safer.
Right. Yeah. And I think when you put it that way too, it's hard to imagine, at least of the folks that I'm thinking of and that our organization supports, even if the individual themselves might be relatively young and healthy, the great majority of folks are in a household with somebody who has more risk factors. And that is, so it still is incredibly limiting.
So that's a really important factor, and I'm glad you brought that up, because people live with other people, and so that has to be part of the equation. Sounds like I'm talking like a mathematician here today, but it's just that there are so many variables, and I don't want people to be anxious and afraid, but I do want them to be cautious and to be careful with small steps going forward.
Right. Yeah, I think that's really good advice. I'm going to just mention right now for those who are participating in this live session that there is a chat feature that if folks have specific questions for Marcia, you can type those in to the chat feature and we'll fit them in here in our last few minutes. But one thing I wanted to bring back up, Marcia, was we had talked earlier in one of these live sessions about families who their son or daughter with a disability lived in a separate household. And we talked about, is it better or worse to bring them back into the parents or siblings household during this time to keep them safer or to limit their contact? Would you have different advice given the point that we're at now? Because I think we had talked that, basically at that point when we were having that conversation, the goal was to have as few contacts as possible. And so if that meant having your family provide for most of your needs for that time period meant you could have fewer total contacts because you didn't need caregivers coming in and out of your home, that was probably safer. Would you say that that's still pretty true, or is that kind of outweighed by the fact that if parents are in this higher risk category and this young adult would like to start to go back to work or re-engage in their activities, is it better for them to then move back into their own place at this phase?
Yes, this is again a very tricky thing. But I think if weighing all the risks, the person is able and healthy enough to be able to return into the community to work, that they should be able to be back in their own residence with caregiving support. I also have been very pleased. I keep asking people in the community, are there people with developmental disabilities who've been diagnosed with COVID-19? Is there anybody in the hospital with COVID-19? Not to know any names, but to know if, there are numbers. And there haven't been. Right. As far as I know, people who are living in the community, not having been in rehab or hospital, because that's a different situation. If they were in rehab and got it, or they had been hospitalized for something else and got it. So that tells me, my assumption is, maybe I shouldn't assume, but I logically, if the people haven't gotten it, still living in the community with caregivers, then the caregivers are really being careful and doing a good job. Right. And that is that's wonderful news. Doesn't mean everybody can forget about being careful, of course, but it means that people have done a good job being careful so they can continue to be careful. That also gives me hope for people to return to their homes.
Okay. So it's something that folks could weigh as they're trying to make a decision about whether it's a short term, we're going to talk about moving them home this week, or think about, in a month or two even, as we see how things develop. But in terms of things to watch for the future, so you mentioned the phased plan, and we can include a link to that folks can find on the Public Health of Madison and Dane County website. There's a lot of really good information in the plan about.
It's a good website. Yes.
Yeah. About activities that are safe right now, or activities that are recommended to avoid. Talks again about a lot of the stuff we just talked about hand washing and when and where to wear a mask. So that's really helpful. The statewide, for folks outside of Dane County, there's also the Badger Bounce Back Plan on the Department of Health Services website that you can look at. And they're updating that as well, based on, kind of the metrics. And we've linked to the Badger Bounce Back Plan just now. And also, I've looked for other counties for what their public health departments are recommending. And it seems like outside of Dane County, there are some health departments that are doing a good job of kind of including recommendations and being very thorough in what folks should or shouldn't be participating in right now, what's safe and what isn't safe. I know
that's good. I haven't spent a lot of time looking county to county, and my concern has been a lot of people really want to get out and go north and, do some maybe local vacationing. So I would recommend doing some really significant research. First of all, what are the plans in that county? What things will be open?
Right.
And how careful are they being? Because you get people from Chicago and Minneapolis and Milwaukee and Madison all gathered together in close proximity. You could really stir things up.
Right.
And have a COVID-19 brew going. Right.
Yeah, no. And the other thing to consider too for folks wanting to, I think this is something that the health department has said, a lot of those communities where people have maybe a second home or a vacation home, they don't have the medical facilities that we do down here in the southern part of the state. And so if you did get really ill while you were up away from your healthcare, your normal healthcare resources, that you might have a more difficult time getting the treatment and care that you need up there.
Definitely, yes.
Yeah, so that's an important thing I think folks should consider. And of course, following all the same guidance and advice about being out in public, right? Even if it's an area where there has been a low incidence of cases, that doesn't mean that it's safe right now. It just means that, maybe, who knows what it means? It could mean any number of things.
I mean, that doesn't mean that it won't be introduced into the county by people visiting, for sure.
Right.
And also could mean there hasn't been much testing done there too.
Right. So, yeah, it does. But it definitely doesn't mean that it's perfectly safe there, even if they've had very few cases. It doesn't. You can't connect those two things. So, and in particular, if you're going to places where other tourists or travelers are going, you're being exposed not only to whatever they were exposed to, but exposed to, things that were out there, people who've come into contact with people from other areas. So you're just greatly increasing your exposure by doing those kinds of things. So things to be aware of. I know it's hard to stay home all the time, and in particular, as the weather gets nice, people want to be enjoying the great outdoors and all of that. So finding ways to do it safely is really critical.
That's right. Enjoy, but enjoy cautiously.
Right. Yeah, it's going to be a weird summer. So
it is. Yeah. And I think a lot of people were hopeful when all of this started that by May, surely things would be back to normal. And then by June, and now, realistically, we just need to understand this is going to continue to be an issue through the summer. We should expect that and find ways to do the best we can.
Yep.
Enjoy it in ways we can safely through the summer.
Yep. Well, Marcia, thank you so much. Any last words from you to the people?
Stay safe. I mean, you hear that all the time, but find ways that you can go beyond your walls a little bit. Take little steps towards being less contained within your home, but continue cautiously doing so with a mask if you can wear it, and definitely keep 6 feet between you and everybody else. Yeah. Enjoy.
All right. Thanks very much, Marcia, and thanks everybody for joining us. Have a great week.